everyone. You're with me, Wilson Damien Asibu, and I'm very glad. To me, when you see me, I know it's about community health in Malawi, and I know I have passion for this community health in Malawi. And if you have any questions or anything you want to know about community health in Malawi, then you can contact me on +265 99 211 698, and I'll be able to help. If you want to connect to any community health worker here in Malawi, or any district, or you are looking for information as regards to statistics or policies or system, how it works here in community health, then you can touch base with me as well. And as you know very well, that I am the national coordinator for the Malawi network of community health workers, and it is a network of over 15,000 plus community health workers in Malawi, drawn from all the regions of Malawi, and we have also regional, district, and local chapters that are responsible for coordination of our activities. But also, just to give you a brief background of the Malawi network of community health workers, is that it started from 2018 when we saw that there are a number of challenges that community health workers are facing. But the goal was not just to look at community health workers or to improve the professionalization of community health workers, or remuneration, or recognition in policy, or them to be salaried, or to improve their working conditions. But we are looking at how we can improve community health in Malawi. We are looking at how we can save more lives that are mercilessly dying in most rural communities, where 84% of the population of Malawi resides, where in most cases people live far from community health posts or centers, sometimes over 10, 15, or over 20 kilometers, to find the next health facility. So we lose a lot of lives, women, children, because of the long distances to community health services. So the better scapegoat has been community health workers, and it is a welcome development. And yet we have community health workers that are not adequately trained to handle most of the community health challenges that are experienced in Malawi. But also, in addition, is the lack of drugs. Sometimes they may be able to treat or to address that health challenge, but the problem is they just don't have the drugs. They don't have the medical supplies, and then it is difficult for them to address these glaring challenges. And you must know that most Malawi areas are lulu, and sometimes the roads are bad. We don't have also ambulances. Even when you call to most health facilities, most of them do not have ambulances. So even if you call them, they will just say, bring the patient here. So you find that even those localities, people do not have money. Most of these people are poor people, and they cannot afford to hire a car to go to a medical facility. And even if they do hire, then you find that out of pocket expenditure is too much, and then people are getting poorer and poorer because of that, and because of also long absence, being in hospitals that are far away. And then you find that they are not even productive, that exacerbating also poverty as well. So then you also have problems with even the community health workers themselves, that they are not even enough, they are not adequate. Now we have over 7,000 community health workers that are needed. That is a deficiency that are needed even in our communities for it to be a little bit effective, and then these are the challenges that are there. And that's why this network, the Malawi Network of Community Health Workers, was formed, so that it can address these challenges. because we saw also that if we leave it to governments and leave it to NGOs alone that are there and the community health workers are not involved, then we are making a serious mistake, because they are the ones that are living with people. They are the ones that understand deeply the challenges of community health. And in the past, community health workers were not consulted in most of the policy interactions, dialogues, planning, and so on and so forth. And right now in 2022, Malawi will, I believe, be reviewing its national health strategy, because the current strategy is ending in 2022 right now. And we say that community health workers must also participate there. And we cannot come up with a new national health strategy and the community health workers are not there. And also the implementation, we want also to make sure that community health workers are there. So I am there to help you, even if when you want to support which community health post you can support, where you can also build, whether it's a hospital or where you think that you can support with the medical drugs, or if you want to support direct community health workers. Like some community health workers, they just need bicycles. Some of them, they need motorcycles, so that they can work better. And you can directly support them. We can provide you with the names, the contacts of those community health workers. You can directly support. We can also connect you to health facilities that need your support. Some health facilities, they need beds. Some of them, they need maybe additional rooms. Some of them, they need maybe shelter, so on and so forth. And then we can provide that information to you. I can provide that information to you. We are willing to give you all the information you need as regards to community health in Malawi. We don't want to see avoidable deaths in Malawi because of lack of information, because of lack of resources, because of lack of trained and professionalized community health workers. So we are here, and my number is +265 99 211 698, and this number is also on WhatsApp, so you can even send me a WhatsApp message so that we can chat. But also, as Malawi community health workers, we have also the report, the national report of our workshop. You have voices of community health workers there, and then you have also the roadmap of what we want to see achieved as regards to community health. But also we have also the action plan for 2022 to 2023, the activities that are there. You can support us, and we need your support, and we are glad that you are there and you are interested to save lives of people. Thank you very much for your attention. You've been with me, Wilson Damien Asibu, and as a national coordinator for the network of community health workers in Malawi. Thank you.